Welcome to the webinar. We'll be starting in just a few moments here. Few housekeeping things. Those individuals that are wanting CE credits, you will need to attend the full webinar. And then after the webinar, there will be a link that comes out to everybody in attendance. If you are requiring CE credits, please make sure the email that comes out may go into a spam folder due to individual organizations' cybersecurity requirements. Also, if you have any questions, please do not hesitate to put them in the question and answer area. Handouts were sent out in advance. If you do not see that in your email, please make sure that you look in your spam folder again for that because the handouts were sent out in advance. We'll get started here in just a moment. Welcome to today's session on empowering a purpose-driven workforce, leading emerging leaders to success. This session will highlight how the leading framework, lead, learning, engagement, accountability, and development, combined with supportive training, mentorship, and resources, can really truly empower new to career and emerging leaders throughout their professional journey. Attendees will gain practical strategies to strengthen their confidence, resilience, and adaptability while understanding how purpose-driven leadership is really essential to meeting the needs of today's and tomorrow's older adults. This session is an important session for all of us as leaders in healthcare. With the dynamic changes in healthcare today, this session will provide you with some keen insight and strategies for success. I am pleased to be here with some of my esteemed colleagues and friends. I'm Lisa Thompson. I'm the Chief Operating Officer here at Pathway Health, and I've been in the post-acute care profession for over 25 years and have served in numerous clinical and operational roles. And joining me today are two additional, like I said, my colleagues and friends, and I'd like to introduce both of them to you. I would like you to meet my friend, and first of all, my friend and colleague is Dr. Doug Olson. He is the president and CEO of the Vision Center, which is a not-for-profit organization that focuses on leadership development for aging services. And the Vision Center was established to help grow academic programs in senior living leadership across the country in partnership with senior care and service organizations, as well as affiliated organizations. Doug, for the past 22 years, he was with the University of Wisconsin-Eau Claire, which is a nationally recognized healthcare administration program, and was the director of the Center for Healthcare, Health Administration, and Aging Services Excellence, which is called CHASE. And under his leadership, this center launched several national efforts to provide opportunities for students and emerging leaders from programs from around the country to benefit from experiences and initiatives in partnership with the field. I would also like to introduce our other panelist, a good friend of mine and dynamic peer of mine, Tiffany Robinson. Tiffany has worked for ComForCare for over 18 years as a training specialist, specifically with onboarding new offices and helping facilitate their training programs. She works with new and current franchise owners across the country, helping them build their teams, training programs, and serves as a central resource for all leaders. She has her bachelor's in social work from Oakland University in Rochester Hills, Michigan, and a certificate in instructional design from the University of Maryland. So welcome both Tug and Tiffany to our call here today. Before we get started, just a few objectives of our session here. And here are some of the things that we're going to talk about. We're going to hear a little bit more from Doug about the current leadership challenges in aging services and recognizing that critical need that we need to really build that strong pipeline or a bench strength. We're going to hear a little bit about some innovative approaches from our panelists here and also discuss a framework, that lead framework here, on how we can look at how we expand that leadership capacity in line with our organizational missions and our cultures, really driving that purpose-driven leadership for the future. And we're also going to spend some time talking about mentorship and training and resources, and also about some specific techniques that were used in the organization to really empower and support new to career and those emerging leaders across the aging services continuum. Because we know that aging services field is facing significant leadership challenges, really driven by the growing needs of an aging population and persistent workforce shortages, as well as turnover of the experienced leaders that are out there. Building a strong pipeline of emerging leaders is truly critical, as we know, for sustaining our organizations and ensuring that high quality, person centered care that our consumers are expecting from all of us, depending not and part of our different portions of the aging services and senior living continuum. We know that there are many challenges that are out there. And we know that aging services organizations, community-based, home and community-based services, senior living, skilled nursing, and others that are dealing and working with individuals that are older adults and aging services, they're facing multiple interlinked pressures, including clinical acuity increases, financial pressures, and consumer growth and demands that are coupled with workforce challenges and the increased need for leaders in this overall market space. We know we have a demographic shift, we have an aging workforce and leadership gap, and that we need to build a pipeline of these emerging leaders, as we know that the need for leadership is there. And we know that there are some leadership vacuums that are occurring, and that there's really what we call that institutional knowledge gap or succession gaps that are happening. And that we know that when we as leaders, all of us here on the call here today, we know that when we design programs to develop leaders, we have to look at being purpose driven and align with our overall mission and culture of our organizations. So, as we continue to face these challenges driven by these growing needs and things that I discussed, I would like my colleague Doug to you've spent your time, Doug, really in that career of researching senior living and aging services and looking at the overall leadership needs that are out there across our country, as well as you have also spent time designing programs to support new leaders in the profession. I'm just wondering if you would spend a few moments in provide some context for all of us to really looking at the current status of the aging services, the whole demographics and that senior living demographics and where we're at right now and what our needs are as we move forward here in the future.
Hey, thanks, Lisa. My privilege to be a part of this with you and Tiffany, and I'm going to really just set the stage a little bit, and it's not going to be a surprise to anybody. We're in this, what I would call sometimes like the perfect storm. We have this aging demographic population growing, and there's lots of ways to look at it, but a lot of people are looking at, starting in January of this year, there's 10,000 people turning 80 every day. There's lots of demographic projections out there that are talking about this 85 plus group nearly quadrupling in the next 20 years. And it's one of those things that we know there's going to be increased demand. There already is. People are already feeling it. We also know that we need really good people to lead organizations to provide the best possible care and services for those seniors that deserve it so much. And I don't want to talk about COVID, but I will tell you that that certainly amplified a lot of things for us. It really made it crystal clear that we need to have some strategic directions around how we're going to replace talent, how we're going to make sure people are capable and talented to lead organizations that are transforming. Everybody on this call has probably got organizations that look very different than they did 10 years ago. I guess the other thing I'm kind of charged to talk a little bit about, Lisa, is the whole background on leadership talent. And, I am very vested in this topic. I feel like leadership makes a huge difference. And there are a couple things that are a focus for us. One is that if you look around, the average age of people that are in this field right now is continuing to creep up a bit. There are still people that are leaving the field. I know that some people made it through COVID, some people didn't, and we had a big transition during that period of time, but we're also starting to see kind of the fact that we need to supply enough people to take the positions and start developing to make sure that we have good, competent, quality leadership. And one of the things that's no surprise to people on the call that I'll talk a little bit about, and maybe a little bit more later, is this whole thing around we need strong university programs in senior care and services leadership across the country. And I'm not going to plug the Vision Center. I'm just going to say that's our primary focus. We've really been making sure that, we're strategically working with universities and making sure their connections with providers across the broad spectrum of aging services is solid. When we talked to people before we got started with this, one of the initial indicators for us was over 90% of the people that we talked to at the time said we certainly don't have enough emerging leadership talent or bench strength to place what we need in our own organizations right now. Moving on, there's also the Department of Labor Statistics already has the projections out there, and I would suggest they might even be a little bit low. Looking at the next 10 years, there's a projected need for the next 10 years of a 23% increase in both nursing and residential care, 33% increase in continuing care, retirement communities, assisted living, and 44% in home and community-based services. Those statistics are rather staggering compared to the overall percentage change in occupations in our country. So there's clearly a signal, and I'd be happy to share more information with anybody because we're constantly working on resources to kind of look at those projections and what we need to do. And going on, that says to us, and this is right out of the Argentum report, almost, well, I would say there was 400,000 positions that are projected by the year 2040, where, some people suggested, why are we looking at this now? I would say we should have been looking at it 5 years ago. And, we're making progress, but I think we need to kind of press the urgency of this issue because it's one of those things that, and Tiffany and I will talk about this a little bit today, that we all have the same situation in place, that it's not that we can recruit from other organizations. We need to recruit from a broader audience. And some of that is from university-based programs. Some of it is the talent you have within your organizations. We're seeing a lot of positive, progressive organizations put an investment into building their bench strength. I'm so encouraged by that. I see a lot more indications of people doing paid field experiences, and I also know that organizations are starting to try to build the bench strength within their organizations.
And
Moving
Doug,
on.
Doug, I got a
Yep.
quick question for you.
Sure.
Talking about this and that need, when you're looking at these numbers, which are staggering for all of us here that are leaders on the call here, you're not only looking at operational leaders, but there's other leadership roles, right? It's not just
Oh,
the leader of the organization. You're talking clinical and other department leaders, right?
yeah, we're talking, I mean, these same indicators are in the Department of Labor Statistics across a broad spectrum of services, culinary, clinical. Um, there is, uh, when we're looking at leaders, we try to look at the depth within an organization and how they can kind of transition. We'll talk about career pathways, Lisa, a little bit.
Okay, great.
But, I think that, it's, and I'll talk about this in probably 2 minutes. It's no organization can be led by one person. And that premise is something that we think a lot about, making sure that if we, honestly, as part of our agenda, we want to make sure the leaders that we're even training or helping them progress understand the importance of that investment within your organization to build a strong management team.
Right. And that kind of leads us into, talking about, different approaches of how we build a stronger pipeline because we know, you talked about, Doug, here is that we have the demographic shift, we have the large gap of leaders and retirement or the gap of the need of leaders. Again, it's building that bench strength like you talked about here and really that purpose-driven, professional development a group of new to career or emerging leaders into our profession here in aging services and post-acute care and community-based services. And we know that having a strong pipeline really will result in a higher retention rate within an organization. It builds a stronger culture. It's really the faster time to competency, meaning that meeting the demands and needs based upon, the type of provider and services that with the service type that we have. It's really that next step, how we get that bench strength to increase that competency in our organization. And overall, we know that will improve the outcomes of the individuals that we serve. So these innovative models really for all of us as leaders here on this call today, we have to look at it differently. It's time for us to kind of take a pause, refresh, and create a new mindset of how we move forward here today. And Doug, would you spend a few moments kind of discussing really that importance of why we need to build that brand strength and some of the concepts and conversations that we have around it to grow that stronger pipeline?
Yeah, absolutely. I mean, I'm going to just take a couple of the reasons why and elaborate a little bit. I think there's very few people that would argue with the fact that to have a strong leadership influence, the stability of that leadership is critically important. You know, we look at statistics that say, the turnover of some of these leadership positions, and I think they're getting better, but the turnover of some of these leadership positions were almost on a yearly or every other year basis for some organizations. And, everybody in operations, everybody trying to do service development, knows that that kind of constant turnover is no way to make sure that your organization is going to stay the course and do the things that it needs to do. Bench strength is one of those things that we talk a lot about now. The importance of having that next person in line, ready to move forward. I think that organizations have gotten over the idea of being penny wise and pound foolish. They want to make sure there's organizations that are really strategically positioned that they want to hire in a way that they have a good succession plan within their organization so that they don't experience as much leadership turnover as they have in the past. And I think the other thing, and once again, last time I'll talk about COVID, but the image of this field is one that a lot of the associations we work with, including the Alliance for Care at Home and others, are really trying to make an impact on how people perceive what this field is about. Being a noble profession, making a difference for people. One of the young leaders I talked to, I asked her why she went into the field, and she said, "I went in because I want to do good for those that did good for us." And that kind of stuff, when it's coming from people that are thinking about getting into this field or just stepping into this field, is so encouraging. And the connection between leadership stability and a good culture for workforce is crystal clear. It's one of those things that if we want to solve the problem of the kind of turnover we have in these organizations, we need to make sure and have good, strong uh, leadership influencing that workforce culture. All right, I got something else up on my screen. I don't know what it was. And then we can move on, Lisa, to the next one. I mean, I want to make sure and give Tiffany enough time for stuff. The other thing is that we all look at when it looks at how we're going to make sure that we have a good leadership impact within our organization. And I said this earlier, it's not just one person that leads any of these organizations. We know it's maybe 10 people within the organization, maybe 30 people. Some people would argue everybody's a leader, but there's a strong influence from leadership and management and making sure that organizations are really on the same page about the direction of their organization. We constantly look at, does everybody on that management team know what are the main goalposts for the organization? Not only the clinical goalposts, but the workforce culture goalposts, and of course, obviously financial. But it's one of those things that making sure everybody is on the same page with the direction. Everybody has their own responsibilities, but everybody does need to be on the same impacts approach. The other thing that we see as a good sign is that all organizations, I talked about organizations transforming, and I know that every organization I work with is very different than it was 10 years ago, but these are the kind of things that organizations need to think about investing not only in how their organization is going to change, but also in the individuals that work within those organizations. And I will tell you that this next generation and even mid-career people are looking for this all the time. They want to make sure they're working for an organization that is going to invest in their career development. That's a critical decision maker for a lot of people going into this field. And I think it's not underemphasized in all organizations, but I think it's one place that strategically people are putting more thought behind. Okay.
So as we look at that, I want to discuss, and Doug, thank you so much because it really is looking at alignment with our culture and our mission of our organization. And as you talk
Yep.
about the importance of really developing that bench strength, I want to, we will also focus on the importance of really raising up the leaders within our community, our organization, as well as externally. And we have to look at an intentional way of starting to do that. And some of us sitting on the call here think, well, how do I do that? Where do I start? And I'd like to kind of walk through a framework that we've discussed here. That's the LEAD framework, which is that look in the learning, engagement, accountability, and development, and talk about that as we look at some different other aspects of innovative approaches here. So the LEAD framework, as I indicated, is learning, engagement, accountability, and development. And learning is really when we're looking at as leaders that we must continuously be continuous learners who stay curious and really stay informed and adaptable to what's going on around us. We also know that the part of growing our team and growing ourselves, growing within in order to grow within an organization, is that we have to have the E portion of the framework is that engagement. So as leaders, we must feel, as well as our new to career leaders, must feel deeply engaged with the mission and that aligns with their team and their organization. And that also leads then to no matter what, as leaders, we have to have accountability. And that's part of the structure and the framework for development and learning is that, that leadership really requires that clarity and responsibility and ownership of our outcomes. And ultimately, it then grows into the development portion, which, our new to career leaders need coaching, they need mentoring, skills building, as well as substructured growth. So the LEAD framework really is flexible. It works for new to career individuals and emerging leaders entering their complex roles. By focusing on learning, engagement, and accountability and development, this framework really helps leaders in growth alignment with the organization's mission, culture, and the commitment to person-centered care. So most importantly, it fosters purpose-driven leadership, helping individuals to connect with their daily work and really that deeper sense of meaning and responsibility. Again, as we all know in the recruitment studies and everything else in retention studies, is having that opportunity to be part of the greater good and meaningful work is key for developing leaders and keeping leaders within our profession. As we move forward here and look a little bit further in detail here, when we look at engagement, and the engagement portion is we're looking at how we connect emotionally and intellectually. So engagement is really a critical component of leadership and development because emerging leaders must connect both emotionally and intellectually with the organization's mission. And in aging services, this connection is really to a purpose, is truly what differentiates great leaders from good ones. And, we're working in a field where our daily actions directly impact outcomes, whether it's clinical, financial, and operational outcomes. So for many of our newer rising leaders, engagement really isn't automatic. It has to be intentionally nurtured. And that's what our role is as we're mentoring and really helping our new leaders to stay part of this. We also know that when you develop new leaders, it offers opportunities for visibility, not only visibility within your organization, but visibility externally. And we know, as Doug talked about, is really looking at those partnerships and gaining that opportunity for our new leaders to not only learn from us, but also to learn from our organization, but also really to learn from external resources and having that opportunity to have access to those external resources, like a fellowship type of program. And it helps, we know when we, in our learning and our processes of leading and engagement, is that it really, like I said before, really impacts retention. We see organizations that have a purpose-driven and a purposeful process of growing their bench strength, that they see heightened retention within their organization and can leverage that for recruitment opportunities as well to bring people within their organization. We also know that engagement creates those learning pathways and creates that opportunity to take that knowledge that those of us that are current leaders or have been long-term leaders, that we can then use what I call that bench strength. We can give our institutional knowledge and teach and train as we grow those leaders. Again, looking across departments and having that opportunity, very, very important for us because it really helps us create that resiliency within our organization. So again, the outcome and the expectation is the way that we can engage our new to career and our emerging leaders in a learning environment as well as an engaged environment. It will help us develop that bench strength in our organization. We also know in this whole process of the lead framework is accountability. And accountability is a cornerstone to effective leadership because leadership truly thrives on clarity and responsibility. It also creates and is part of that confidence building. Now, I'm not saying that we are being taskmasters and we're teaching people to be just that we're looking at truly an accountability culture. Accountability has to be part of leadership, but really it gears us towards that ownership culture, which is alignment with our mission and our culture of our organization, creating that ownership, that engagement with the organization. And another important step in this overall accountability process, as while we're developing leaders, is setting clear goals and expectations, creating a professional development plan. And Doug's going to talk a little bit more about that, but it's creating those goals and you having those frequent check-ins. And part of that process is that check-in is that you have a mentor and that mentoring process, how important that is with accountability, with really, really truly growing our new to career professionals in our organization. Again, our strategies that we use is we clearly define those roles and expectations, and that we really assign stretch assignments with some clear outcomes, which helps with that accountability. And then we create that development plan with the mentoring process and truly find ways that we can engage that new leader into our day-to-day priorities, have them understand what's happening within our organization and the reason why and the rationale why we make decisions within our organization, and giving them additional insight and perspective in our profession and looking at strategies for the future. Again, helping us build that bench strength within our organization, because then that leads to that next step of truly that development process. And that's building and identifying. It's that skill building and identifying building for the individual. It's really, again, like I said, creating that formal mentoring program. And it's truly helping us really being intentional development strategies. Again, going back to building that clarity and that confidence for that individual, creating that pathway for success for for that individual, and leveraging not only internal resources, but also external resources, such as, our academic resources and others that Doug is talking about. And you'll hear more from Tiffany as well. Because when we create these clear pathways for our new to career professionals and those emerging leaders, we're creating those milestones for them, and they're vital. They see a visual roadmap and they see how they can progress. We have time to, again, have that positive reinforcement for success and for the successful outcomes. So again, that lead framework is just a way of, when you're looking at it as you as operational and clinical leaders here on the call, you can take that and break it down into each one of those letters and say, okay, where's my organization at with each of these areas, with learning, with engagement? We're looking at accountability and development. What are the things that we as an organization need to improve in order to create a good development process and identify new leaders and new to career leaders within our organization so we can develop them and upskill talent within our organization? And when we look at that, Doug, this is just a basic framework, and you've done a lot of research and you have worked with organizations across the country, worked with academia across the country. Could you give us some additional context of things that we could look at, or thoughts or insights that we should consider as we identify and develop new leaders for a purpose-driven workforce?
Sure. I'm just going to highlight a few things, Lisa, and I'm going to make sure we leave plenty of time for Tiffany. So I'm not a slide reader. I just want to emphasize a few things. One is that, you really have to have a culture, uh, of camaraderie and respect for each other within your management teams. I mean, it all starts there in many ways. And I think understanding, what does that team work like? How do they function together? Lisa mentioned the lead framework. We also have a diagnostic tool that we've used with organizations that help them kind of really critically understand, how that team functions together. I think there's also, it's really important to avoid kind of stereotypes about what kind of, what role this position requires when there's lots of different dynamics around how people do what they do, and just really leveraging on the strengths of that organization and the strengths of that individual to make sure that they're really using their best. I don't know of too many people that come to work with a mindset they're only going to do what they have to do. Most people come to work every morning saying, I want to do the best I can. I think we need to accept that and really kind of leverage that, because it's also, it's important because, we always talk about interdisciplinary collaboration. And our field is so dependent on the fact that you've got a team that comes from different disciplines and perspectives, but they can really work together. And I think that getting to know the different kind of work styles and approaches that people bring to the table. And it's not like everybody's suited for this work, but I think most people are looking at individuals and trying to kind of foster the best of that individual. And maybe it even means changing a role. But from my perspective, I think that it all starts with that management team being in sync with each other, having each other's backs and supporting each other. I think it's one of those things that you can feel it often when you go into an organization. It doesn't take long to get a sense of people kind of have that mutual respect and camaraderie. Moving on, I would just say that the other parts of this is, nobody will be surprised when I say this. I think it's very, very healthy and very good for an organization to have a lot of intergenerational respect. Um, I'll just start with the fact that this next generation is really coming into the field with an understanding that they want to engage with the residents, they want to engage with the tenants, they want to engage with the clients. That's what they're called to do the work for. And that's what brought them to us. And I think one of the things that just have to appreciate, and people always kind of label and put different generations in their boxes. They all have different elements, and this could be a whole webinar on intergenerational approaches. But I do want to emphasize the importance, because I think in a management leadership team, having a diversity of ages, backgrounds, and perspectives is a huge strength. It's a huge strength because everybody looks at things a little bit differently, and you can really leverage those kind of perceptions. I will talk to some people and they'll say, well, we can't, it's a lot of hours, it's a lot of work. Well, that's true, but you also have to respect the fact that there is a work-life balance that people need. I mean, I think that the generations that are coming into the workforce today are looking for, what are the elements of flexibility I can have in my own home life. I think there are some organizations that are doing great work around that area to keep people engaged. Maybe it is a 1 day a week that they can work remotely. Maybe it's kind of a little bit more of a flexible schedule depending upon what's going on. And I just think that people that are paying attention to that understand that, it's happening in every other discipline, and it's happening in a lot of other occupations. And I think that our field has got a chance to continue to grow in that area. I think that, I said before, this one person I talked to, doing good for those that did good for us, they want to be connected to their work. That's why they come to work. They want to make a difference. And then lastly, and then I'm gonna be quiet because I want to hear from Tiffany, is the last thing I want to focus on, Lisa, is just this whole notion of internal and external. And I always talk to organizations about this. On the internal side, Lisa talked a little bit about career pathways, clear and simple. I often will work with organizations where if you're an employee, you can almost go to their website under career development and you can see these are the opportunities available for me to continue to grow. I love the fact of that transparency because it's front and center. I think that there's also a way to kind of influence and engage your mid-managers or second lieutenants or whatever you want to call them. I think they're such a critical force, and they're probably underdeveloped in many ways and under invested in. I think some organizations really get it, but I can tell you that, there's leadership potential in almost every one of those individuals. And even though I run the Vision Center and I want to make sure we get enough new talent into the field, there's a lot of talent in the field right now. And I think investing in though to grow is critically important. Lisa talked about professional growth. I think every one of your mid-managers or high potential people should have some kind of a professional development plan. This is where I want to be next year. This is where I want to be 3 years from now. This is where I want to be 5 years from now. These are some of the things I want to do. And I think that it's also kind of it really does incorporate around it, kind of brings an openness and transparency to the organizations around real good communication and clarity around those areas. Externally, nobody will be surprised by this. I think that, we do have to, as organizations across this broad spectrum of aging services, be intentional about reaching out to universities, colleges, technical schools, high schools. You can name your flavor. I think having their involvement, visiting your campus or your organization or your clients, making sure that they are really available to have good field experiences with your organization, and we're very, very, very strong around the importance of a paid field experience. And I'm not suggesting what levels, I'm just saying that, investing in those people, there's a value proposition that clearly their energy, enthusiasm, interest in taking on different types of projects is phenomenal. And I think that there's also universities that are thirsting. Universities are going through their own struggles too, and they want to make sure that they're in touch with the community. And I've seen any number of universities I'm working with right now that are putting together programs so that people that are actually working for organizations can move forward with a set of courses for a credential or a certificate. If someone already has a bachelor's, maybe they don't want to go back for another bachelor's. I don't think that's real practical all the time. And, making sure that there's opportunities to connect with universities around that. There's all kinds of ways to do collaborative projects too.
Well, and
And I
Doug,
think, go
Doug,
ahead.
talking about this, before we get to Tiffany here, is you developed a concept that you've put into place and it's been very successful, like a new to career or an emerging leader, a fellowship program within an
Yeah.
organization. Can you explain a little bit about how you did that and what that kind of looks like? It kind of takes that internal to external and it creates that path.
Yeah. I mean, I think that, one of the things that everybody on this call probably could identify 10 people within their organization that have a high potential. And those people, without a lot of extra resources, even, can work together, get kind of in their own assessment of their own individual needs and strengths and kind of areas that maybe they need to improve, work in a cohort kind of model, make sure that they have the opportunity to kind of have a mentor within the organization. Maybe you give them the opportunity to go to some conference that they never would have expected to go to. And, you kind of just focus and get them off on the right track so that they're focusing on their own personal professional development. They've got the right kind of resources and support. That's all around the whole staff development thing. I think and there are organizations that are really doing a great job with this. I've seen more and more organizations invest in kind of a leadership cohort model. And I think that there are templates out there. Obviously, we have templates, but there's just different ways to do that. And it's amazing. It doesn't cost as much money as people think it does. It's just kind of reallocating some things a little bit and making sure that you're strategic about how you're working with these folks. The last thing I want to give credit to is because I mean, associations have a lot of great resources for people at all levels within your organization. And I think it's always important to kind of pay attention to that, pay attention to what kind of opportunities they can provide. That's part of why you're belonging to them. And just to leverage kind of any kind of resources they have. They've been
And
a great support for the Vision Center as well.
yeah, and that kind of leads us into, when we're talking about this at the internal and the external and practical strategies, really to how we create these purpose-driven workforce, is that, when we look at that opportunity for different types of training approaches that really help us empower that. And Doug, you talked about some examples here, but I wanted to bring in Tiffany here because she has, her background and what she does is she does the training, education, and creating these types of programs. And Tiffany, I was wondering if you would provide us with some really the real world examples of And really that of a partnership driven kind of innovations that support a purpose driven workforce and how to create opportunities to enhance the care outcomes. And you've got some great insight to share with the group here.
Absolutely. Thank you, Lisa. When fostering a culture of purpose-driven care, we want to turn the focus on equipping individuals with the knowledge and skills to provide care that is tailored to their patients' unique needs and preferences. Gone are the days of providing care in a one-size-fits-all model. Today, we have to prioritize our clients' values, choices, and goals. We have to start from day one when working with new to career team members and stress this importance from the very beginning. We want to promote shared ownership of purpose driven care across all disciplines. Everyone owns a piece of the puzzle, and everyone is needed to collaborate and create training culture that works. We come together with core purpose and philosophies, and we weave that into each training module that we provide. From day one, your team should be fully immersed into your organization's mission, vision, and core values. They must not only know what we do and how we do it, but they also must understand why it matters. Why do personalized approaches to healthcare that focus on a patient's sense of purpose help them have better outcomes and quality of life? Why are we doing what we do? Why do these approaches matter? We need our teams to understand how the sense of purpose and empowerment and independence come into play when we assist and provide care to patients. When working with your team, use real life scenarios to drive engagement and practical application by making learning more relatable, hands on, more impactful. Consider utilizing role playing and simulations for these training sessions. Running through scenarios and role playing can really aid in helping new staff build confidence, empathy, and practical problem solving skills. Reinforce learning through continuous feedback, mentorship, and coaching. Think about providing supervisory visits to check in and see how care is provided and offer feedback. If someone needs additional support, provide some on the spot coaching through a skill or process. Also, offer mentorship programs to allow more experienced staff to help grow and support your less experienced staff. This can help with strengthening skills, helping value based behaviors come routine. This also helps your more experienced staff become leaders in your organization. You want to co develop training with input from staff, families, and care partners. Even after training is created, keep these lines of communication open so we can keep growing the program to meet the growing needs of our patients. Rarely is a training perfect from day one. Be open to ongoing surveillance and updating of your training programs. Great leaders are ones who are willing to adjust training and processes as needed. Next slide, please. Let's talk more about training with collaborative partners. When we work with our partners in care, we find places to enhance care outcomes. We want to foster alignment by sharing core training with partners like home health, OT, PT, hospice, etc. Consider group training, joining forces, creating training that connects everyone together and encourages communication and collaboration. Use joint training to clarify roles, reduce duplication, and enhance communication. We are always using our training to help our staff be more efficient, provide them with a clear understanding of who is responsible for what role or process. How do we work together? How do we share what is going well? How do we share concerns along the way? These are important questions to consider as we are working together. Let's talk about how we get this training out to our teams and partners. Leverage technology. Do not be afraid of venturing into the virtual world. E-learning can have huge benefits for your team. It allows training to be provided at your staff's fingertips. It can be available to them 24 hours a day. Blended learning can also be beneficial when working with multiple teams. This takes the in-person training and the virtual training, puts them together, presenting some topics in person while allowing other topics to be covered in a virtual element. Even after initial training is created and things are running smoothly, still make sure you're having collaborative sessions. Bring everyone together for ongoing check-ins and alignment of goals. Use this as an opportunity to encourage new leaders to guide discussions. Promote a unified care approach. Let's work together. Let's keep communication going so we can reduce duplicate work and tasks. We want to encourage new leaders to champion cohesion, accountability, and high quality outcomes. On the next slide, we will review an example of a training plan in action. In the example I want to share today, we're looking at a home care agency providing care to a client in the home that the client has lived in for 60 years. This client has already worked with other agencies in the past, and she's not thrilled to be working with us. Her biggest complaint is she doesn't like having strangers in her home telling her what to do. She does acknowledge that she needs help with her personal care, such as bathing, dressing, getting in and out of her bed and chair, and is no longer able to keep up with keeping her home tidy or to drive herself on errands. The first thing we did, which we do on any new client, is perform an assessment and put together a care plan for our caregivers to follow. However, we really placed an emphasis with our nurses to make sure that care plans include the client fully in their creation. We want to know specifically about this client's preferences. When does she like to wake up? What does she like to eat or drink? How does she like to spend her day? We want to start from the very first interaction with this client, showing that we respect her, we want to provide support to her, but we will not take over, and she is still in the driver's seat when it comes to her care. When it came to training our caregivers, we determined that we needed to include many newer aspects of person-directed care training. We wanted our caregivers to not simply see a list of to-dos and run through the list with a client. We want them to honor and respect the client with each and every task, making sure our staff understands the importance of not coming in and taking over, but instead making sure that the client's environment is safe, but respecting their autonomy. The training was provided virtually through our learning management system to the caregivers. We included courses on client autonomy, including clients and everyday decisions, and providing support safely, but not taking over. This helped our caregivers provide a more positive and fulfilling experience to our clients. We also provided training solutions for families by offering periodic workshops on important topics. A regular topic is person-directed living. These are our partners in care when we're working with their family. It's not just the professional support staff who need reminders on this important topic, but also the families who are invested and working side by side with us. This has been a huge benefit to families who may not fully understand the consequences of coming in and taking over as their loved one's physical abilities decline. After this approach, specifically with this client, we were met with a client who was not feeling constantly on guard with our caregivers. She felt very much in control of her caregiver experience. We found that by encouraging this client to go out and run errands that she used to do on her own, but now doing those with her caregiver, that this was still able to provide her with a feeling of independence. The past agency that she had used had their support staff run the errands for the client and not allowing her to still be a part of the process. The simplicity of allowing the client to go to the grocery store and still be the person choosing the produce and vegetables really allowed her to feel like an active member in her care. Her and her caregiver preparing meals together allowed her to feel like she was not being pushed aside and not having any choices in her day-to-day. Even something as simple as what would be prepared for meals. Her two daughters, who lived locally, attended our family workshop and both felt they were leaving with a new perspective on helping their mother navigate her changing condition. Throughout this entire process of individualizing the care for the client, we also make sure to encourage and empower our staff to be leaders every day in the client's home. We want them to help our clients live their best quality of life. We also want to encourage them to communicate with us on the training and management side of things. What areas are we missing the mark on? What do we provide too much training on? What do we not provide enough training on? Keeping lines of communication open with your team is ultimately going to cultivate a culture of client first and purpose driven care. Lisa, Doug, I'll pass it back over to you.
And Tiffany, thank you so much. I really love, what you did and how you frame things because, again, like Doug had said, it does not take it, it takes intention, it takes the process of development. And what you did is you walked us through a real life example because we know leadership is all different levels within an organization and how you were able to look at where the current client situation was at and what the outcome was of developing that leader at all different levels within an organization and what those outcomes were. And again, it really shows us how what you shared demonstrates just how powerful intentional support can be when it's woven into day-to-day operations of an organization. And so, as we move forward here and we look at this, is that, now that we've explored the how and how we train emerging leaders and how we can support them and how we can invest in their growth and had discussions about, some frameworks that we might consider as leaders here, how do we fit all these pieces together? How do we create a cohesive, a sustainable approach that it really ensures leadership development does not happen by chance, but by design, just like you were talking about, Tiffany, as well as Doug. And it's really to help us bring all of this together. I want to walk through kind of that practical roadmap, one that connects today's insights into long-term action as we go here. So as we know, as we look at what we discussed here today and a lot of great and wonderful information and showing the current status of where we're at in the current healthcare environment, especially with those of us that are working everything outside of the acute care setting and what we're doing. And we're working with individuals in the senior living and older adult environment and community-based services. We know that it brings us to how we start this process. And first and foremost, like Doug said, and what you said too, Tiffany, is that we have to identify who those emerging leaders are and doing this early. And it's not just those with titles, but those who show curiosity, initiative, and really that natural influence on others. And from there, then you could go in and look at that lead framework and use the lead framework as the foundation for growth, weaving in the learning, the engagement aspect, accountability, and development into your everyday leadership practices that you have. And then next, you could develop learning pathways that expose the new leaders really to the full care continuum and to your organization, specifically to what you do and the purpose and the mission of your organization. And what it does is it aligns us that leadership development with the mission and culture of your organization, making sure that every program, the mentoring relationship, and learning opportunity reinforces not only your priorities of your organization and the outcomes and the anticipated outcomes that you expect to the individuals that entrust their lives to you every day, but it also reinforces the why your organization exists and how you will care for those individuals and those patients or those residents or those members. And then you can create that supportive environment through mentorship and coaching. And then where those leaderships are in us as leaders ourselves are challenged to be mentors, but also develops our supervision, our mentorship skills, but also gives that opportunity for the mentee to ask questions, to create that path for growth and success, and really allows that individual that's new to career or that emerging leader to never really feel like they're left behind to navigate this process alone. And finally, we really measure our progress through clear goals and a structured feedback. And don't forget to ever celebrate the leader growth along the way, because recognition builds confidence and it really continues that momentum. Like Doug was saying, was that we have to have that momentum to build that bench strength within our organization. So when we follow just this roadmap for implementation, we just don't fill positions. We create a sustainable leadership pipeline that will really support our organizations and the people that we serve for years to come. So, as we look at opportunities here as developing and really empowering a purpose-driven workforce, leading emerging leaders into success, we know that today's session is that we really had three big key takeaways that I really believe and define why this conversation matters for today. First, we know that aging services is at a crossroad. We are serving a rapidly growing population with increasing complex needs while navigating intense workforce pressures and a historic, really, transition of leadership and the changes in leadership and also the gaps of the need for leaders that we have. The future of our organizations and the quality of care that we provide depends on building that strong, purpose-driven leadership pipeline that can carry us forward into the future. Second, developing and leveraging a framework for structure. We talked about the lead framework, the leading, the learning, engagement, accountability, and development, but really the other frameworks, there's many frameworks that those of us in our professions have had, but using a framework for structure, whether it's a professional development plan, a plan such as what Tiffany talked about, and walking through those processes. How do we identify? How do we teach? How do we train? How do we get that information out? Whether they're remote or whether they're in person, what is that process? And then how do we follow up and give that feedback and then monitor those outcomes? That is going to be key for success because we have to have a framework. It is really a roadmap for sustainability and excellence. And third, knowing ultimately is that each of you plays a vital role in shaping tomorrow's leaders. Every conversation that you have, every emerging leader that you mentor, every stretch assignment that you offer to someone, every moment of encouragement that you provide plants a seed that will grow into strong leadership for our entire field. When we invest in emerging leaders or new to career leaders, we are investing in the future of aging services and in the well-being of older adults and families who depend on us. I want to thank you all for your incredible work that you do, for your leadership that you demonstrate each day, and for being part of this important and meaningful conversation. Together, we have the power to inspire, develop, and elevate the leaders who shape the future of aging services. Again, we are at a crossroads here and we have that opportunity. And we want to, again, thank you all for sharing time with us today, because I know you have got two dynamic leaders and mentors that are on the call here with Doug and with Tiffany. And knowing that together and leveraging that roadmap for success, we can create a purpose-driven workforce and really empower new and emerging leaders into our profession for sustainability. Because quite frankly, I'm going to need that because I'm entering that age of potentially needing services. And I want to continue to work with dynamic individuals such as Doug and Tiffany and working with the leaders across the country to, again, provide that good quality care and services and outcomes. So, on behalf of all of us here today, we want to thank you for joining us here on our session. I don't see any questions here in the question box. So, again, if you have additional information or you want to seek out further clarification or learn more from Tiffany or learn more from Doug, you can see that information here. Their contact information is here on the slide. And we want to thank you all for joining us here for today's session. As a reminder for those individuals who need CEs, again, look in your email within 7 to 10 days. You'll see an email that will come out and a link to the information that you have for CEs. Again, double check your spam filters to make sure that you see those CEs. So thank you all for joining us here today. And again, we are on that mission to create that purpose-driven workforce and identify and create new leaders to successful outcomes for all those individuals that we serve each and every day. Thank you so much for joining us here today.